Just yesterday, Madison Police Chief Mike Koval released new numbers saying the city has had 211 overdoses just so far this year. That's a 48% increase from this time last year.
So Nalixone, also known as Narcan, has become a standard for first responders' uniforms. But as the demand for the life-saving drug goes up, so does the price. Our medical expert, Dr. Mandira Mehra, joins us this morning to talk about what this means for the opioid crisis. Good morning, Dr. Mehra.
Good morning. Nice to be here.
I think this is something that we have discussed before as far as Narcan and Nalixone goes. This is a drug that can reverse overdoses, essentially.
Exactly.
But the price has gone up by like 6 times. What does this mean for that community that in recovery?
Yeah, this is such an important topic, and I know it's not the first time we're discussing this opiate epidemic. You know, unfortunately, it's become the leading cause of accidental death in America. And you think, okay, car crashes and other accidents, maybe those are avoidable, but this is a really avoidable thing. And so Nalixone, often known as Narcan, is something that blocks that opiate receptor and can reverse an overdose. So we're talking invaluable, completely life-saving for patients, emergency responders, doctors alike, even just people out in the community that may have other opiate or heroin addictions as well. But it comes at a cost. And of course, as the demand has gone up, because now it's recommended by the FDA, the CDC, that this be readily available, manufacturers have continued to rise the prices. So we're talking hundreds to thousands of dollars. And of course, this is a really generic medication. It's been available for over 20 to 30 years, so it's not a revolutionary medication. But of course, they're sold at, well, this is a new format, perhaps it's injectable, perhaps it's a nasal spray, things like that. And so usually some of them are available for even a couple hundred. Some insurances are covering it, some are not. But the problem is that when EMS needs it, a patient really needs it, it's not just so easy to afford.
It's really scary.
It is. Now, we have to ask you about a new study out this morning that I think every Wisconsin person can get behind. This news that eating more butter and cheese can help you live longer.
Yep, here I am. So it's not all bad news. I usually am the bearer of bad news, and we say eat low fat and, you know, limit your dairy consumption, your cheese consumption, don't clog those arteries. But here's a fun study. Here's some good news. So this study looked at over 130,000 patients, so a very large study in over 24 different countries. And it actually studied the benefits of the people that were eating high fat, that full fat, yogurt, cheese, dairy products. These people had less cardiovascular risk and less mortality, morbidity and mortality. So here's something that now shows us, you know what, maybe those French people eating those all-fat cheeses and all-fat milks, maybe they're onto something. So the guidelines haven't changed as of yet, but the CDC, the FDA, is now looking at this and seeing, why was this beneficial? So obviously, if you have heart disease, if you have high risk factors, please talk to your physician. Don't just start eating butter, cheese, and lots of milk, but definitely talk to your physician. But this might be something that's going to change in the near future as we notice, you know what, maybe eating these high-fat content cheeses, dairy products in limited amounts does have some health benefits.
As you always say, everything in moderation.
Everything in moderation. You got it.
Easily the best news of the day. Thanks so much for joining us this morning.
Great to be here.
It's good to see you. All right, your time.